won't stop us. Floods won't stop us. We are here to raise our voices, to let Albany and all of Western New York know how critically important it is to save our hospital. Travel times for emergency care will double and even triple in some cases. Lives could be lost if we lose Lakeshore.
To Albany, New York City, but also to Washington, D.C., that Lakeshore Hospital will not close because we are going to stand united and fight for this incredible institution in our community. We need health care, access to health care. We need the jobs that are associated with this facility. And as our populations age, when we face, in rural areas in particular, a shortage of health care already, we cannot lose any more healthcare providers in our region, in our district, in our part of New York State.
We have hometown heroes, and that's our first responders.
We're not in it for the money, but just the satisfaction of knowing you helped somebody out is more than anything could buy. So, with all these people up here, the backbone of this community, let's stay strong, let's keep Lakeshore open, and thank you very much.
The emergency room at Lakeshore Healthcare Center sees approximately 12,000 patients annually. If all of these patients are forced to seek treatment at other medical facilities involving longer travel time and longer waiting time for services, as other facilities struggle to absorb those patients with their existing resources, people are going to die. Lakeshore Hospital was founded in 1965, built on a vision by our local physicians and our community to give quality health care. Our mission has not changed. It has been better than 5 decades now. Why would we put less value on a human life today? Let us turn back to the original vision and purpose. Don't put a price on human lives.
Despite receiving millions of dollars in state grant funding and recent upgrades and renovation, what bothers me the most with regards to the intent to close Lakeshore is something very simple. This is not the movie Wall Street. You know what I'm talking about? This is not the movie Wall Street. You don't take the millions of dollars and then try to dismantle something and try to buy it at a cheaper price at the stress and at having the community at large in jeopardy. You don't dismantle something after receiving millions of dollars. You don't mess with the lives, communities, and jobs in Western New York, and my district, Kathy's district, Senator Gallivan's district. You don't mess with Western New York in that fashion. It's one of Chautauqua County's largest employers, as you know, employing over 460 people. It's a critical part of the local and regional economy. It averages over 25,000 patients a year. They come largely from rural populations in northern Chautauqua and northwestern Cattaraugus, southern Erie counties. 20% of the patients in Lakeshore are Native Americans. It's also heavily relied upon by the Amish community and hundreds of seasonal migrant workers that are here. Lakeshore is also utilized by a host of the visitors that come here to enjoy our shores at Lake Erie. Lakeshore patients come from over 68 municipalities in Western New York, and if you included Buffalo and all the suburbs, it's 85 municipalities that actually rely or have some connection to Lakeshore Hospital.
I still believe that medicine is an art, not just a science. The care you get in your local community is better because your family, your friends, your neighbors are there to care for you. We need to keep those jobs. We need to keep this valuable community asset.
We as Native people, we see medicine in a lot of different ways. But what I see here today is the fact that there's medicine of the mind is our greatest asset. It's about cooperation. That's how you set the groundwork for healing, for discussion, for dialogue, for solving problems. You know, there's good medicine and bad medicine of the mind. What I see here today is a lot of people that are concerned about putting their minds and efforts together to pull that medicine together in a good way. The critical care and services of Lakeshore have been a part of our community for a very long time. It's serviced us through the generations. So it's a part of us. We're concerned about it. And we want everybody to understand that we don't know at this point what position or what part that we need to play, but our hands are out there for any kind of cooperation that is seen fit. We too felt like the community, this area, was blindsided by business decisions that really didn't take into concern the people of this region. We see kind of the settlement that's going across in healthcare, and we're part of a rural community. Rural communities are kind of left out, you know, as far as health care services are meant. And we want to, as a Seneca Nation, we want to be in a position to help bolster that position. We think that we are in a unique situation. We want people to really think creatively about the partnership and relationships that we can have with this area.
I'm supervisor of the neighboring town of Brant, where the residents have used this facility for over 50 years. Disasters come in many shapes and forms, and with it much loss of life. This could be a very big disaster. It is absolutely appalling and a disgrace to be closing this very important facility that has saved thousands and thousands of lives through the years by stabilizing critically ill patients and victims of accidents that otherwise would not have been able to travel so many miles without proper attention immediately. It is horrifying that we are standing here this day and trying to find a way to save this lifeline. I myself would not be here this day if it were not for the excellent care I received immediately from Lakeshore Hospital. I died and they revived me.
This is an important hospital. The closing this hospital could be measured in lives. As everyone has spoken here, we understand the critical nature of this. You know, some folks have said that this is a business decision and they have a right to make a business decision. No, it is not. This is a community hospital that is run by a not-for-profit organization that has taken millions and millions of taxpayer dollars, all while not paying taxes in their status as a not-for-profit organization. They absolutely have the obligation to provide the services to this community that it requires. We will not stand idly by and let an out-of-state for-profit corporation make decisions that will impact the lives of our community here in Chautauqua County in Western New York.
As your county executive, I will not rest until we bring this to the successful conclusion that we have.
We want the hospital to stay, and we're here to support it. In Lakeshore, we have a brand new, state-of-the-art emergency room. When we needed help, Lakeshore was there for us. Many of you here have received critical care from Lakeshore when you were sick, when you needed help. Now it's time for us to give that help back to Lakeshore so it can stay open for us forever.
What does the possible closing of Lakeshore mean to EMS providers? First, there's a greater demand to be placed on the volunteer units, like say how long they will be able to operate effectively. Secondly, greater stress will be placed on the equipment and vehicles of the respective service, which means earlier replacements, which means an increased burden on the taxpayer. But the most adverse effect of the closing could be the difference between life and death, literally. Extending transportation time will be a very negative factor in patient care. It is the duty of those of us in the medical field to protect and preserve life the best way we can. Taking an ER out of this equation, even a small ER, but a very modern equipped, up-to-date ER, is both illogical and dangerous to the community. There are many ramifications associated with this increase in transportation time. Obviously, the most important one is the well-being of the patient, and that's the one we have to be most concerned. The sooner the patient can be delivered to facilities which can better handle the problem in a more controlled situation, it's the better for the outcome of the patient. While we have great pre-hospital care in Chautauqua County and Southern Erie County and Cattaraugus County, and we have paramedics, well-equipped emergency room with doctors, nurses, and staff is far, far better than trying to do it in the back of a well-equipped ambulance. These people put their lives on the line every time they go out on a call.
The pathways that got us to our present situation can be undone. we have a chance. I know the people I work with. I know they are forced to realize staying means mortgages, car payments, and food for their children may be at risk. Some of them have told me all they know is how to take care of other people.
If there's an emergency situation and time is of importance, the delay in getting service could be costly, even deadly. The nearest hospital from Gwanda will be over 20 miles away. Lake Shore is 3 miles from Silver Creek. Brooks Hospital in Dunkirk is 15 miles. Running an efficient and cost-effective operation is the key. But it's not cost-effective to have to continue to pay salaries to the tune of hundreds of thousands of dollars to administrators that have had their contracts terminated after they were extended. I can't believe that in the 5 years since the Berger Commission report that the administration of Lakeshore Hospital failed to implement a strategic plan for elimination of duplication of services and no increases in areas of services recommended in the report. I can't believe the administration's intent to close the facility suddenly became evident in October of 2013. The August 1st issue of Business First speaks of the hospital's plans to build a $1.44 million, 11,000 square foot musculoskeletal center, including a renovation to create a physical therapy, occupational therapy outpatient clinic, and occupational medicine program, and upgrades totaling $1.1 million to renovate a 1,600 square foot imaging area, replacing a 10-year-old CT scanner. 2 months later, the hospital has to close? What is the administration's reason for refusing to negotiate with SEIU 1199 regarding severance packages for the caring, dedicated employees that have served for years at Lake Shore Hospital? Part of that negotiation process is having access to financial records of the hospital. Why are conditions being placed upon the investors who have come forth in an effort to keep Lake Shore Hospital open?
We have heard from first responders from as far away as Lake Erie Beach in the town of Evans that the crippling of their services, should they not be able to bring people here, as opposed to having to wait 4, 5, and 6 hours at emergency rooms in Buffalo and elsewhere. We cannot put this kind of strain and stress on our emergency responders. They put their lives on the line to help people they do not know. This hospital needs to be here to assist in that critical emergency service operation.
That's not an overstatement, but we in rural areas deserve and need to have access to quality health care.